know about the pain in the leg is normally affects old people, and it's as a result of cold and stress. That's the main thing that is the cause of that pain in the leg.
It's as a sort of what I know about it. Joint pains, especially old men and women. These are a sort of lack of taking care of one's health, and also not knowing what to do at a particular time. For example, there is what we talk of wellness. When we talk of wellness, you are taking care of ensuring that cholesterol and all the things that will affect the joints are taken care of. But ignorantly, most people are not aware of it, and it's affecting them. At my age, I'll be able to take care of it, and I don't feel it. But I feel for those who are feeling it. I wish they can be able to look out and ensure proper health matters.
Well, I'm not a medical doctor, but I know that osteoarthritis has to do with joint pains, especially in adults, whether male or female.
I don't really know much, but I know, like the little I've seen, old men, women complaining about their bones, their knee especially. I guess overweight. It's caused by overweight or something, I don't know. Though my mommy has started complaining of such, but not really bad.
What I know about that arthritis is mostly among old women, and mostly not old women again, as from 40 years of age. Women also especially feel pain on the legs. Yeah, because of, they say it's because of when women is labor, that's what causes rheumatism for women at old age.
It affects men. I think based on age and kind of destiny, it affects men from the age of 40 upwards. So, but it affects more to older people.
Is it not this elderly old age sickness, romanticism? Yeah, I know about it. That's partial stroke.
All right, you're welcome back. This is We the Doctors. My name is Dr. Valeria. If you are just joining us, we have been talking about osteoarthritis, generally what we call rheumatism or arthritis. So in this segment, we're going to be giving you tips on what to do if you have this condition, ways on how to manage it. And then one of the things I think I would advise a lot of people who have issues with their joints and find it difficult to work around and all of that is that you need to get some walk aids or some devices that can help, immobilize and reduce pressure on this thing. So you probably may just need a walk aid, a walking stick, and all of that. And there's some therapists, that also help with that, basically, and tell you the kind of things you need to do to the kind of exercises and stuff like that.
Exactly. Is talking about bearing the weights now, getting some kind of support. Sometimes the physical therapist can recommend something for you, because I know they have like fancy walking sticks. We have the shifter and sit title, and we're not talking about all those ones. There are some kind of walk aid. No, we should say these things. There are some kind of work aids that are prescribed for you, so it's individualized.
Yeah,
so
it's funny how when we're younger, when we see people with walking stick, we thought it was, a thing of fancy.
Swag.
But there's a fancy one. Advanced walking stick. And you don't hold it in and feel like 1 hour. Not knowing that some people were actually using it, as walk aids actually, because they had issues with their legs.
So it's even a good way to protect yourself against, falling victim to osteoarthritis. If you know that there's a pain coming on, you are talking with your doctor, I want to start using that cane that I used during the wedding. Some of you use that cane. You have to use it now. And of course, exercising. Some exercises can be very beneficial. Walking, biking, and besides, swimming, the physical swimming. And the physical therapist will guide you in that. They also have occupational therapists that can guide you in the exercises that will be beneficial for you.
Also, pain relievers to help anyway prescribed by your doctors depending on your medical condition or maybe a drug that you're already taking. So it has to be prescribed by your physician anyways. But pain relievers help a great deal. You also have things like gels, pain relieving gels, creams that you can use for this condition as well.
Yeah, you can use water.
Mm-hmm.
Now, but when I say
like
water, I don't just mean drink water. Because that's what you get at times. It's cold and hot compress. And talking about cold and hot compress, this is the second time we're having Ifoma send us a tweet on our Twitter handle at We The Doctors. Ifoma was asking which is better for an aching joint, hot water or ice cold water. Whoa. I guess she's talking about a compress.
Yes, cold compress or warm
think of them actually.
Because you can use both of them. It's important to understand what each one is doing. When you use cold water helps to shrink the blood vessels and reduce an area that is inflamed. Inflamed means that is swollen and has pain. Now, in osteoarthritis, at times you have these flares. It's relaxed, and after a while,
so it relieves the muscle spasms and stuff.
It relieves
stiffness.
The swelling, and then reduces the pain. That's basically what cold water does.
Yes.
But when you use hot water, you are trying to free up your muscles. Relieves its stiffness. So if you find out that your osteoarthritis comes around the time you are waking up, there's pain and there's also stiffness. The question to ask is, what do I do? Luckily, there's there's this study now that showed that you can do what they called contrast bathing.
Yes. Okay.
What basically means is try the cold water, then go ahead with the hot water, and try the cold water again. Yeah. But important to everybody is don't leave this cold water on your skin for more than 15 minutes. Because your skin will still need the circulation of the blood vessels.
Absolutely, absolutely. So before people just put hot water for longer or put cold water for longer. I think one other thing that we should have mentioned basically is this, and we need to clarify. When you have osteoarthritis, it's advisable you see your doctor. True. Because, there are some other procedures, even surgical procedures, people have to do and all of that. But, you don't just conclude and say, look, they just said I should take over-the-counter medications, or they said I should get ice block, or use hot water, and I'm fine. Or you always need to see your doctor. Exactly. He's always in the best position. If you need to get an orthopedic surgeon, a physiotherapist to attend to you, or you can be managed by oral medications.
Okay, that has been our show for today, osteoarthritis. And like we keep on saying, follow us on Twitter if you have a question or you'd like to be a guest on the show. Just follow us at We The Doctors, or for more information, you want to go to cooltv.cool, okay? I want to emphasize on what Dr. Valeria said about the timing. I've had cases where patients would take hot water bottle and put it in the area and sleep on it, and then they'll wake up with a scalding injury. So you have to be careful. Like the consultant said, with an x-ray you can diagnose it, so you can't just wake up and say, oh, I have arthritis. Okay,
so you need to see your doctor.
You need to see the specialist. All right, that has been it. Thank you so much for listening. Hope we've helped you with all this information. For myself, Dr. Jules, Dr. Valeria, Dr. Yvonne, and Dr. Okay, we are saying bye-bye.